So personalized to me, you have to remember we're not an assembly line. I know we all have these policies and protocols that we should follow. Those are great, but for certain things and certain patients, we cannot combine them, right? Also, it should be evidence-based, but at the same time, let's not make it one size fits all. We have to make it what size fits you, is how I like to look at it.
Welcome to Personalized by Vitamin Lab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Dizer. Please remember that the following discussion is for educational purposes only and is not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome back to Personalized by Vitamin Lab. I'm your host, Dr. David Dizer, and today on the show, I'm speaking with Dr. Meenu Vaid, someone whose career really embodies the true meaning of whole person medicine. Dr. Vaid is triple board certified in internal medicine, infectious disease, and addiction medicine, and she's also a certified wellness coach. Her approach blends the best of conventional medical science with holistic strategies, always with an eye toward root cause and lasting results. In this episode, we dive into the world of personalized addiction care, exploring supplemental strategies, the risks and benefits of vitamin therapy, the importance of lifestyle change, and even what it's like to provide care within correctional facilities. Dr. Vaid's unique perspective brings together both clinical expertise and compassion for those on the path to recovery. It's a thoughtful, practical conversation that I think you're going to value. Please enjoy our episode with Dr. Meenu Vaid. Welcome back to another episode of Personalized. I'm Dr. David Dizer, and I'm here with Dr. Meenu Vaid. Nice to see you, Meenu. How are you today?
I'm good. Hi, David. Thank you so much for having me on your
You're
show
welcome.
today.
Thanks for coming on the show. I'm really excited to see you. I said in our pre-chat that I'm trying to interview people all over the place when it comes to different professions, for example, and different spaces within medicine. And you have a really cool space where you're working that I think a lot of our viewers will benefit from hearing kind of your journey and your approach and how you're supporting people. So I'd love to jump right into it if it's okay with you. My first question for you is, can you briefly tell us about your training and what really led to you working in correctional medicine and addiction care?
So a little bit about myself. I was born in India, raised in Chicago, Illinois since I was 1 year old. I'm the middle of two brothers. I did my postgraduate training in Chicago, Illinois as well for internal medicine and infectious diseases. My husband's also an internist. We have 3 lovely children. Moved to California about 15 years ago. And that's where my correctional journey actually began. And I'm going to tell you, I don't know if you're familiar with the stigma associated with working in corrections. When I first started, I would get a lot of questions like, why are you working there? Why do you want to see those patients? Were you not smart to get to work into Kaiser or want any of the big entities? And it took me a while to realize that, to become this confident woman that I am today and be like, regardless, we're going to treat the patients. We're going to treat your high blood pressure or your diabetes or any other problem that you come with, regardless of your background. And it was in corrections where I got the opportunity to get trained in addiction medicine because we have a diverse population, but addiction's very common. And I got trained there, had a chance to get board certified. I also went on to write a children's book. I got my certification in wellness coaching.
Wow. Holy, you've done so much in your career. Yeah, no, my father-in-law worked in a correctional wellness and sort of a wellness space as a social support worker. And he saw it as helping people who are not getting support in the way that they need it. And he saw it as sort of a social enterprise, kind of entering into this kind of higher calling that he had. And, I think he was able to do incredible work with the people that he was working with, as I'm sure you are. I see it as being in a very important role. And of course, you have this opportunity to help people who really need you. So tell me about some of the ways that you help people. What is your kind of day-to-day life like?
So day to day, right now, currently I work in a jail. So we have a high turnover rate. A lot of times there'll be the same patients that are coming through. I want to say about 70% of our patients come in intoxicated from one or the other substance. So it's really trying to get nursing and the providers to be able to identify some signs that they should look for who should be unstable. We'll often have patients who will become the heart rates really fast because they've been using meth, or someone who had their last drink several hours ago and they're at risk for having delirium tremens. So those are really key factors, those first initial days. And if we get everything at booking done correctly and they get seen by the providers in the right time, I do that. I'll see patients as well throughout the day besides having to manage the administrative side because I'm the medical director there currently. But I see patients and I enjoy the patient aspect, but I do not like writing notes. I am so glad there's AI scribing now, I tell you.
It makes a huge difference.
It's actually fun talking to the patients because everybody has a story.
And I bet it really helps with your personalized care, like your ability to kind of support the person in front of you. Can you tell me a little bit about that in that setting? What is it like kind of using this kind of approach, this personalized approach in that setting?
So personalized to me, you have to remember we're not an assembly line. I know we all have these policies and protocols that we should follow. Those are great. But for certain things and certain patients, we cannot combine them, right? If you have a history of liver disease and you're drinking, I can't just be like, all right, I'm going to give, and you're an alcoholic. I can't be like, okay, give him something to eat, but I got to make sure I replace the vitamin B1 because you're putting them at risk and they're going to end up having cognitive dysfunction. Also, it should be evidence-based, but at the same time, let's not make it one size fits all. We have to make it what size fits you, is how I like to look at it.
That's a great way of putting it. And tell me about the difference between this kind of acute stage and the long-term wellness that you're using to support these patients. So let's separate it into the two. So someone comes in and you're saying that 70% of people who come in are intoxicated and it's you who's supporting them and helping to manage their care. What is that like on a day-to-day basis?
It depends. There's I think in anywhere in medicine, it's some days are good and it's pretty much okay. It's the same bread and butter. We have this. And then we'll have the days where someone is just not, we've had overdoses and we have to be able, they're on the spot and Narcan is carried by all of us. Everybody needs to know how to administer it. How do we do it? And as you know now with fentanyl and now the stronger and stronger they're mixing it, it's not like heroin where I gave you one dose of Narcan. I'm sometimes giving 7 Narcans just to get that patient to respond sometimes. I've had patients who will come in florid delirium tremens, and we're trying to stabilize their heart rate's not controlled. We're running IV fluids, and they didn't do that at the jail before I got there. So then we got everybody trained to make sure that we can do some of the immediate care that's necessary while we wait for 911 to get these guys to the hospital and all of that.
Right, right. I understand. Well, and contrast that with this long-term wellness approach and how different that really is. Are you having an opportunity for multiple follow-ups? Are you doing long-term care? What is it like?
So now in correctional settings, it's not the same as it used to be where people were kept in jail for a certain amount of time and then they get either go to prison or they get released. We do tend to have patients for a fairly long time. We do chronic care management just like you would do in the community. If you're not stable or your blood pressure or your blood sugars are not controlled, we'll see you more often. So we do tend to provide all that care and definitely a chance for follow-ups with the patient. And it's very important to develop that rapport. That's one thing. Corrections is a whole different world. They live by these certain rules. You said you're going to do it, make sure you do it. Because that gives you the biggest credibility. I've learned that. Talk to them like they're a person. Don't treat them like they're an inmate. You don't know over my years how many times I've had it, oh, you talk to us like we're humans. And that one always somehow gets me because
Yeah.
I'm like, but you are human. And I think they've gone through the system so many times where people are just looking at them differently. So that kind of is where the stigma is. And that's where I love being like, no, we're not doing it this way. We're doing it my way where we all are the same. The more kindness, the more we try to do that, the better chances they're going to do to recover. And I'm always like, hey, don't come back here now, okay? We had this talk. I don't want you to do it anymore.
Yeah, exactly. That's very healing on its own too, don't you find? Like just being able to connect with someone like that and acknowledge them, it must really support the care in a positive way.
For sure. I mean, some days they'll just, but it gets overwhelming because sometimes they're like, oh, they only want to see Dr. Vaid. And I'm like, no, I
Right.
can't. It's
Definitely.
draining too. After a while, you're like,
Oh yeah, completely, completely. Do you take it home with you?
oh, I did that for a while. Oh my God, my training years, I was a big crier. I
Yeah.
used to take it all home and it took a while, but still, some things that you hear go with you and stay with you.
Right. You're a complete medical family now with two parents who are physicians. Did you grow up in a medical family?
My parents actually have an Indian grocery store business. We do wholesale retail in Chicago, but
Cool.
we are, on my dad's side, we're 13 cousins, and out of us 13, 12 are physicians.
Wow. Wow. Incredible.
Both my brothers are physicians, their wives are physicians.
Oh my goodness.
Yeah, I
Wow.
think
That
we,
must be
yeah.
very, very cool. Holy, a whole crew of physicians. So, everyone must be working in different spaces. I mean, like, I didn't quite catch. How did you end up in this space? Was this a calling for you? Was this random chance? How do you end up working in corrections?
That's where I say things happen for a reason. It just happened by random chance. We moved to California and I had just had my second child and I was out of medicine because I had prediabetes and I always have like these 9-pound babies. So I was like not working. I finished my infectious disease fellowship and I was moving at the same time and we were doing all of this and I was studying for the board. So I wasn't actually in clinical care for a good year. And when we got here, everybody was like, you just got to start working. They don't like it in California. If you're not working, you're not going to get a job. And I was like, what? And California is very like, you have to remember it's saturated. You have so many physicians. You have one infectious disease doc who's going to stay there for the next 15, 20 years. And so it's hard to really get your foot in the door when we came here because it's my husband's side of the family here. So it's hard for me. And luckily, one of his cousins got us into the corrections, and me and my husband both started actually working together in corrections.
Oh, wow.
That was an experience too.
I bet. Husband and wife team, same spot, same place?
Yeah, we had different yards, but the funny thing about corrections is everybody knows. But the inmates will know before everybody else that works there about, oh, are you guys married? I'm like, no, I don't even know that guy. I heard he's terrible.
For sure.
Vitamin Lab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and Vitamin Lab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
Oh, that's too funny. That's too funny. That's one thing I really like to cover on this show because, so people have different journeys. Like I said, my father-in-law worked in corrections and gave seminars is kind of his thing, is to talk with a bunch of people and hold these group sessions, and found it to be quite a rewarding career. And he did a lot of good. And look at you ending up there and now entering into this kind of world of personalization and optimization, having this opportunity to support these people. Tell me what that really is like. Is there some elements that you have? Obviously you mentioned the B1 already, but what are the elements kind of personalization that you can use in your application in supporting these people?
So I would say all elements of the patient itself, right? So we're going to look at your past medical history, what medications you're taking. We're looking at family history. We know that genetic predisposition is such a big risk factor for substance use disorders, if anybody in your family used any of those. We're looking at what kind of habits do you have? Do you have stable housing? Are you homeless? I need to know all those questions, right? Because are you someone who has sexual relations with multiple partners? That brings in another. Are you using needles? Do you share razors? That brings in a whole different level of, sexually transmitted diseases. hepatitis, HIV, which allows me to bring my infectious disease expertise in with at the same time. So it's interesting that way. You'd be surprised how many with syphilis is on a rise. We see quite a few syphilis cases in the correction setting, also in my private clinic that I have, which is by appointment. Similarly, so that aspect is very important. Social factors are so imperative. We also want to know about where you live, what kind of area that is, right? Some of us didn't grow up as privileged. If we're not in the best setting, we want to try to find a way to kind of either if we can move you from that setting or change the environment. That's going to help you be more successful.
Absolutely. Okay, this is so well rounded. It sounds like an excellent holistic approach there. Can we pull some pieces out of there for people who are working kind of in private primary settings, who are working in this kind of medicine? Because it's really coming where I'm from in Vancouver. Of course, addiction is a major challenge for our community. Sort of everyone from all walks of life, from the family docs to the specialists to the integrative people like myself, and even some of the people who watch our shows, like for example the physios and the chiropractors and massage therapists. We're all having to deal with people who are experiencing this kind of suffering. Can you give us some advice? Like, let's say we're really good at taking an intake and we can kind of check all those boxes that you mentioned in your holistic approach. It's still a lot. Like, what is the mindset? What is the framework that you go in with mentally, emotionally to be the best you can possibly be?
So I think it really depends on who's in front of me. Even though no matter how prepared I'll try to go, I'll review the chart or I'll do that. But you have to remember with substance use disorders, the number one factor is that they have to be ready. If they don't want the change, we can't force it. And, now the more I do, read into addiction and doing that, what is addiction? It's basically the ongoing use of any substance, right? It doesn't have to be drugs or alcohol. It can be social media. It can be food. So I actually am the treasurer for Golden State Obesity Society that we opened up. And I do the mind and body talk about how food, that's an addiction for us. I mean, how many of us cannot even put our phone down? It's constantly there. There was no smartphones. There were just smart people when I was growing up. But that's going to make such a big difference, right? And when I go in and I talk to you, are you ready to make this change? And how I approach that, because your triggers are going to be different from my triggers. One of the biggest factors is ACEs, as for adverse childhood events that we've had. And no matter how much, we don't remember every detail, but things that happened to us or we silently observed. I don't know if as you are getting older, do you ever notice like you start certain things come back and play in your mind and you're like, oh, that's what that really meant. And I do that and I'm amazed, like, wait, I have this vague memory of this. And that made me a certain way that I am, certain things that I like to do. And it's because of whatever shaped me. So we want to talk about those, recognize those signs. Eating disorders are so huge. And it's really hard for us to help these people. And you're trying to rewire their brain. So besides trying to look for subtle signs, I have to be able to build that rapport where I can talk to them. And oftentimes, I think this is something I learned my intern year. I had to go tell a patient that she got diagnosed with cancer, and I was kind of at a loss of words. And I just kind of stood there, but standing there and holding her hand, she just started talking. Told me about her life. She told me about different things. And you kind of start to learn that even though we're trained that we have to have all the answers and we need to tell you what to do, what the plan of care should be, sometimes they don't need the advice. You just have to stand there and let them have that space to say stuff. So many times I've walked in and the patient doesn't want to talk to me. And I kind of just stand there. Or there's so many underlying mental health things. They go hand in hand. Substance use, mental health disorders. I see that day in, day out. And they don't want to talk to you, or they're going to say bad words. The number of times I've been called certain things. But I'll still stand there and I'll be like, all right. I used to initially get mad.
Oh yeah.
I'd be like, whatever, you called me a bitch. I'm not dealing with this. But it took me a lot of work on myself to be like, it's not about me. And so you have to give that person grace, and stop thinking that you're the most important person in the room.
Right. Yeah. Oh, that's really helpful to hear from you. I mean, we've had a counselor on the show where we had a very similar conversation before, and to also hear a similar sort of review from your angle is so powerful for people, I think, from all different professions. So I'm really glad to hear that. So you've made connection, you've created space, there's some trust building that's happening. And now we're talking about really help supporting this kind of personalization, this strategy for both lifestyle design and for actual medical approaches, whether it be pharmaceutical or natural approaches. Let's go through lifestyle design first. Like maybe we could focus on the correctional setting and then kind of open it up to non-correctional setting. What kind of strategies can you use once you've developed that trust to help people avoid substance?
So you're probably familiar with the lifestyle medicine pillars. It's so big right now. I think that is the most important framework that we should have to go with, right? So starting off in corrections, first off, let these people sleep because whether they're using stimulants or they're using opioids, they probably haven't slept that well. There's not good quality sleep. Sleep is gonna fix those things. It's gonna change the brain. It's gonna give you better judgment, making better choices. So sleep is one of those pillars that we talk about. Nutrition, feed them. You want them to have nutrient dense foods, right? Let's cut out the processed food. That is harder, I agree, in corrections because we work with the kitchens and the people who supply us, and we're trying to implement more fruits, vegetables, less processed foods. But you know how funding goes with a lot of those systems. But we have been able to now start to cater the diets to certain things. I can order like liver specific diets, I can order renal specific diets, I can order high fiber ones for the patients who need more fiber. So that is nice that we are able to do that.
That's really nice. Oh, that's so great to hear. I don't think that's happening in British Columbia. I really don't.
Oh, really? So, no, because you would not be surprised by the number of grievances we get about food. All I'm getting is peanut butter. I want this. That guy is getting ice cream. So then we have to be
Mm-hmm.
like, all right, let's look at what we're doing. But
For sure. For sure. Continue on your thought because this is really powerful, I think. So sleep, nutrition, checking those boxes. What happens next?
physical movement is another important aspect. You know, exercise, there's so much evidence to say that exercise, it not only brings down my risk of diabetes, makes my heart stronger, it's also great for our mood, right? They say it's the best non-pharmaceutical form to treat for depression. And you are going to be more alert. And it doesn't, I'm not a morning person. So I tried for years. I thought that's what I had to be successful. That did not happen. And I'm like, all right, this is what's going to be. But any time in the day, if you can put in a little bit, whether you do wall sits between while you go to the bathroom, or whether you throw in 10 jumping jacks, any bit of movement makes a difference, even though it's recommended 40 to 45 minutes, 4 to 5 times a week. But let's just start getting that physical movement. There's a reason why they say move it or lose it.
Definitely. What kind of pushback do you get there? So is the patient population you're working with excited about this, happy about this, or are we getting a no thank you, doc?
So there's two groups for sure. You have the people who are avid exercisers. We have a lot of gangs. So some
Mm-hmm.
of the gangs actually have requirements to
Okay.
exercise. I've had people who've had hand fractures and they still have to do the exercise. So they will be every day they have a routine. One person's the lead, he's going to count, and the other guys are going to do it. Then I have the other guys who say the bigger they get, the better it is. And they're like, no, we need to do this. It's for our safety. And I'm like, how is being really overweight for your safety? They're like, no, that's what makes us stronger. And I'm like, no, that's going to make you slower. But certain thoughts and beliefs that we have are so personal that I'm never going to be able to change those, right? Foods and habits, we all choose things. You can't be like, here's the manual and everybody do this. It just doesn't work.
That must be a big challenge. It must be such a big challenge. How does the supplementation go? Is there potential for vitamin therapy in your setting?
So in corrections, we do vitamin D. There's so much evidence base for that, right? We need it for our bones. We use calcium just to give us healthy bones and be able to move around. We will definitely do B12 or iron, folate. Those are very common. All our pregnant ladies get prenatal vitamins, and if you need iron, we will definitely do that as well. I'll use magnesium. We know that's cardioprotective, and I'll use that also sometimes magnesium glycinate for patients to help them sleep. We have a few premenopausal people. So a lot of the stuff that I do in the community, I do it here too. It's just that in correctional settings, our resources are a little bit more limited. And at the same time, they push us for evidence based. And if I don't have sufficient, like, oh, my up to date or this resource did not say that, it'll be questioned.
Yeah, okay, that makes sense. Are there anything else to this approach before I ask you for some examples that you want to add?
So we talked about nutrition, exercise, that social connections is another.
Tell me a little bit about it. So personalizing social connections or understanding about the different dynamics. So what is it that you're supporting people with when it comes to social connection?
So in correctional settings, they all get groups. So let's say you'll have groups catered to what things. We have anger management groups. We have substance use groups. We even offer like people to get their high school degree. But at the same time, when they're in these groups, they're interacting with people. They're getting that chance, hey, what answer did you get for this question? Or how they're having that, and it's time out of their cell. So that's great. They love the ability to come out and actually go, or when they get yard time or they get that, they love those times. And social connection, we all know after COVID how big of a factor that is for our well-being. How much mental health went up after COVID. We saw so many more cases. No matter how much people say, I don't need anyone, I'm independent, it's not true. We do. We're humans. We need connection.
Were you there during the COVID times?
Yeah, we still had to go to work. We still had to try to cut down the chaos because they were scared. Everybody's scared. And there was so much conflicting information. So
Definitely, definitely. Can you give me some examples, or maybe even just one, where you've seen this kind of personalization, this holistic approach, applying the principles you've discussed, where it's been very helpful?
So I have a patient right now that does not want to take medication. As you know, in the community and in general, people are trying to step away from taking allopathic medications. They want to find what's natural or what they can do. So he has a history of alcohol use. So what we've done is been like, okay, let's work on the sleep, because he was having sleep disturbances, which is very common with alcohol. People think they're drinking to sleep, but it's actually making your sleep much worse. So we worked on that a little bit. We tried to build healthy habits. Let's look at bedtime as your sacred time. Make that routine or anything that's going to help you, right? Do you need it to be dark? Do you need it to have ambient lighting? Do you like having like a sound machine? Whatever it is. Do you want to try to practice meditation, mindfulness at that time? So meditation doesn't have to be where you're sitting on this yogi pillow and you're sitting with your hand in that pose that they always show. It could be while you're walking. It could be while you're laying down, right? You got to be able to make use of that. And it's okay. The thoughts are always going to come. They're never going to stop. But you start to get to the habit of where you realize that, hey, let's just let it be. I struggle with mindfulness all the time. And a lot of work it takes, right? So bring that once you get that routine and you're able to sleep. So we did that with him. Then we looked into environmental factors he would talk about like his wife kind of nags. I think we all wives tend to do that. It's a criteria for us.
No.
And so we had to discuss a little bit like, okay, what is under your control versus what is something that you're not going to want to fight about. And we did a lot of that. It took a while with him to be able to balance that. And I'm like, what do you want to fight for? So this is how we're not going to fight. This is how we're going to do it. We took that approach. Then we went into other aspects, right? Let's talk about your childhood. So a lot of motivational interviewing where you come to this decision And we try to move you from the pre-contemplation phase to let's take that action and let's take that next step. So that makes a lot of help. And I also started using like magnesium, melatonin to help with the sleep aspect. We made sure he was getting good nutrition. The same six pillars keep coming, working on the stress. Whenever we're stressed, we are never going to make good choices, right? All of these things, any one of these six will always impair our judgment if they're not fine-tuned. Whether it's avoiding toxic substances or spiritual connections are so important too, right? It's that higher power. You don't have to be a religious fanatic. It's just finding something that is higher above us. And it's hope. I think that's what makes humans different from animals, right? We always live on that hope. Tomorrow will be better.
The fact that you're teaching this in this setting is so empowering. I mean, so often just like daily life is exhausting in clinical practice, and the fact that you can do it in that setting is really, really cool. And I'm sure in this case, definitely transformative, but I'm sure you've been able to help so many people because of it. Help us transition a bit to community practice, and maybe if we could talk a little bit about the different drugs with addictive potential that you have supported people in coming off, and maybe if there's any specifics about protocols or ways that we can help people. Like, for example, I was working with someone this morning who has an addiction to both cigarettes and marijuana. And, I'm trying to tap into my protocols, and I was thinking afterwards, I was about to have a chat with you on this podcast about how I've worked with people before who have been addicted to more dangerous, more serious medications or drugs. And I haven't been good enough at supporting them using this kind of personalized approach. I'd love to hear if you have any tidbits that maybe might help people kind of in my setting. Anything that comes top of mind?
So, one thing I have to say, marijuana, ever since they've tried to legalize it, people just think it's okay.
Yeah.
And there's not enough research. And the more you're looking at it, you're finding that it's not. So one of the big things, I also mentor teens in our community. And I'm constantly being like, hey, take a little bit, just take 10% of all the stuff I know home with you, because what's the number one age I've noticed that it's textbook. All my patients, I ask them, how old were you when you first used anything, whether cigarettes, alcohol, or drugs? And it's always like 12, 13. Middle school age is when all of a sudden they're experimenting, and all these hormones, and you don't know what you're doing, and you're trying to follow the crowd, stand out. It's so much pressure for them, and sometimes you forget that I need to step in their feet a little bit, instead of just being like the person who's like, no, do this, do that. But there's a lot going on for them. They may not have the same problems we had, but that's the whole benefit of us evolving, right? The problems change a little bit, but we all have problems. They don't stop. That's how life is. Life will keep lifing. But so the marijuana aspect is difficult because people will be like, oh, I use it because of my anxiety. I use it for my migraines. So I do have to tell them that if you're less than 25, your brain's not even developed. And now you've changed that wiring a lot. Where you're relying on this, it's slowed your reaction time. I find a lot of times when I try to find something that they kind of relate to, like, hey, did you feel like you forgot things? Or did you feel like you're not as fast as making a decision? That could be from this. The nice thing about like cigarette smoking or opioids now, we actually have treatment, right? We have medications that we can support them with. With nicotine, Chantix has been such a lifesaver. Even though if you don't quit, you bring down your number of cigarettes down significantly. You have the nicotine patches, the gum that can help slowly wean you off. So that part is nice. With alcohol, we also have stuff that takes your cravings down if we give you naltrexone. So medication-wise, we're good. The hard part, like with methamphetamines, that's a big one that we see now, right? Everybody's using ice, and then Breaking Bad did not help us.
I bet it didn't.
Everybody wanted to make it, so.
Oh, goodness. So what's that like, helping someone who's going through that?
That's harder because we don't have any sort of FDA-approved medications, right? There's a lot of experimental stuff. Like I know we'll use antipsychotics like Remeron because it's mood stabilizer, helps them sleep. For people with stimulants, they're on like this high for days. They're just manic, right? They think they're the God's gift to mankind, and they're running around They haven't slept for days. They don't even know. They don't even know what they've been doing. So they have trouble recalling. Next thing you know, they're married and they got somebody pregnant. They don't even
Wow.
know that.
Hmm.
So that's the hard part for those guys when they're coming down to look at the ramifications of their use. So you want to support those guys significantly. Um, their heart rate's going to be really fast. And as you know, like when we're anxious, you feel your heart kind of racing. That's an uncomfortable feeling, right? So they feel that. Plus, they haven't eaten probably for days. At the same time of chronic use of methamphetamines, they're going to develop this psychosis. And you'll see that's why they're like, oh, he fried his brain. I see that a lot too, where now they're not making that much sense. So, in that aspect, you can really just provide a lot of supportive care. Sometimes we need to give them benzodiazepines to just kind of help them calm down and feel better. I don't know if any of that helped you, but
It does. I mean, it helps me so much. Oh my gosh, because I would be, and I have been, felt ill prepared, of course, in my setting for these type of situations. But you made so many great points there. I think one of the great points that you've made is about the timing, about when addiction really begins for most people, and it's at such a young age. I come from Nova Scotia, where there's a big alcohol culture, east coast of Canada, and I was thinking back as you were saying that it's 14, it's 13, it's the time when it's kind of just considered to be kind of a normal part of life there. But the problem is that there's not enough education around the risks, which is what you transitioned into about being under 25 and the damage of marijuana on the brain. And basically the challenge for, I think, the community that I'm from is, the difference between hard alcohol versus beer and wine, and the significant negative ramifications of such potent alcohol, and just really not having the education around that. So the fact that you're educating, I think, is something I can kind of take away from that.
do you show them like the picture of how many drinks is actually considered okay? I've noticed that people don't realize that's a good way to sometimes, just like I remember they used to show like this much sugar is in this one and this one, and then you're kind of like, oh wow, I didn't know this boba had enough sugar for me for the week. So I like to show them like, okay, hard liquor you can have this much, or beers you can have one a day, but then anything more than 7 drinks a week for women is considered a problem, and more than 14 for men is considered a problem. That's a really important thing to identify. Where now, in the past, it used to be men had these issues, but now women have caught up. And it's sad that of all the things that we wanted to become equal in, we chose this to catch up on.
Definitely. Oh, for sure. Totally. No, it's a really great point. It's we have to speak to the old recommendations here in Canada because Health Canada has moved it from 7 and 14 to 0 and 0. So it's been it's a little different here now. But that conversation is still so relevant. Are there investigations that are helpful in addiction medicine, for example, lab work and an assortment of investigations that you think could be supportive of personalized care?
Oh, for sure. Labs are so important. Number one, I would say, is liver function and kidney function tests, because that's going to help determine which medication I can use, right? If your liver enzymes are high, certain drugs I can't even try on you, or you're at higher risk for having inflammatory liver issues because of the medication. Also, I like to look at vitamin B12. Anybody who's a chronic alcoholic, they'll end up developing megaloblastic anemia. So they need B12, they need folate. In acute phase, yeah, they need B1 and they need glucose. Remember, I don't know if you guys call it banana bag in
No, I'm not
Canada.
familiar.
Oh, so for us, one of the things we always called it was a banana bag. So it's basically like this bag that was like kind of yellowish in color, but it had all the vitamins. So anybody who's on a banana bag, they're in alcohol withdrawal during our training. So that's just basically B1, glucose, all of that to get them like perked up and feeling better. So that's very important, because if we're going to give just thiamine without giving glucose, they're going to go into encephalopathy. Very important to remember.
Fair.
Also, what other stuff? I do like to correct the vitamin D levels, because that also has been some evidence to show with mood and stability. I'll do those. Labs are pretty big. And you want to make sure you get STD testing, because these guys are the ones who are going to be the highest risk. Multiple partners, and especially when you are not even aware of your surroundings. We're going to make wrong choices.
Definitely.
You're not going to know whether this person had any sort of disease because who walks around and says, hey, by the way, I have HIV?
Absolutely. That's a great point. Can we go back to the liver enzymes? Can you give me an example where there was a situation where you would have wanted to use a medication but couldn't? What would the medication be for? What would it be? And what would the labs show that told you couldn't use it?
So if the liver enzymes, the AST and the ALT are elevated, usually normal is 40. But if I have somebody in the hundreds, I'm going to avoid using naltrexone because that is also one of its side effects. And then I might gear more towards a camprosate, which is used for alcohol as well. And that would be, but the only thing, so we try to use naltrexone because it's once a day dosing. A camprosate on the other side is 3 times a day. So that, as long as your kidney function is good, we can use a camprosate. So I've had that time where I'm like, okay, we have to hold off on the naltrexone. Let's try to get you healed first and monitor your liver enzymes. I mean, at the same time, now I'm sure you're familiar with MASH, the metabolic alcoholic steatosis, not just alcoholic, but just fatty liver. We're seeing it more and more because of the processed foods, just general weight gain, diabetes, everything's up. So even before your liver enzymes are elevated, you'll see people already have changes in their liver. So have to be very aware.
Definitely a good point about the naltrexone. Now, especially in non-alcoholic fatty liver disease, I'm sure there's some people I'm thinking about where I have to consider that. Thank you for that.
Even buprenorphine will kind of mildly elevate your liver function test as well.
Definitely. Okay. Okay. Thank you. Good point. So, I'm trying to think around personalization and optimization in these settings, and really, I wonder if there are any other things that we could be doing in a community setting to help people. Are there any other specific drugs, for example, or interactions that you think are relevant, or approaches that are reasonable before I enter into this next set of questions? I've got some questions around behavior change and habit formation that I think would be helpful. But anything you want to add before I enter into that space?
So I think biggest thing is resources, right? Knowledge is power. The more we educate and get things going, similar to how we started the syringe program, right? So where you can dispose of your syringes safely, there obviously was a difference between people saying now you're just letting them use more versus the people who are like, no, we're trying to get them to be safe. Those are great resources that we're trying to provide, plugging them into systems, trying to get the people who are homeless stable housing. The homeless people are the ones who are going to be the ones that are more likely to use for sure, because who wants to be living on the street and be experiencing every minute of that? It's a good escape for them. So we want to give them that stable housing, find them, maybe if we can help set them up with jobs, get them those resources. We used to do in Chicago, we'd had programs which would get them like bus tickets, federal funding where they had that, or they had a social worker who was coming to check in on them. Because sometimes you just need that to be like, hey, it's similar to having the sponsor for AA. And that's one of the reasons why AA has been so successful all these years. Because they go in there, there's nothing expected of you. You want to talk, talk. You don't want to talk, don't talk. Listen to other people's stories. But you can also get a sponsor, someone who's going to be by you when you're struggling, like, should I do this or should I not?
Definitely, it's a great point. It makes me think about how we're ever going to accomplish this in Vancouver. It's such a big challenge for us up here. Recently a new proposed social housing, but it was an excellent idea, but they didn't have enough resources allocated to the space. And so it would have been a complete mess because of this resource allocation. People like you supporting people on the ground, they need to be there. And I think it's a great kind of analogy or a connection to make with the AA program and the support that people get in that social part of it. I wonder how we're going to be able to do it kind of in the community and as a population.
I mean, we have to all try to be the change, right? A lot of education, I feel like I have to tell people, look at it just as diabetes and hypertension. When your loved one doesn't take their blood pressure medications, do you get mad at them? You still tell them, oh, okay, here, take it now, or let's do this, or stop eating those French fries, it's too much salt, right? It's kind of look at it that way. It's no different. Their brain wiring is different. They can't make the decisions like they used to, or like you and I do. And some of us, I mean, there's genetic testing even, like that shows certain people are more predisposed. You can even do like CHRNA5 that's used. Like you have the GABA testing. All these, so much is in the works that kind of can tell you that who's going to be more higher risk.
That's a fair point. I think that's a really, really helpful point to consider on the investigation side. But it also made me think of one other thing, which I'm really interested in. That's the food noise reduction, because I do work a lot in obesity in my practice, and we use a lot of GLP-1 medications. And I'm wondering about the new research showing about their potential in reducing other addictions, for example, aside from food. Have you looked at this space, considered the use of these medications as well?
So it's a lot of it for even GLPs for addiction, they're bringing it in. What they're finding, I've noticed, is that there's such a big difference between like and want. And you don't know where, so if you think about it, it's different. And I thought that was an interesting concept. Like, I like pizza, but then there are certain things that in your brain, they're like, I want it now, right? And that is that noise. So then they're finding, and that's the number one thing why GLP works great for people who are obese, because you don't have that noise anymore telling you we have to eat. If you think about it, as growing up, there used to be in our ancestors scarcity of food. There wasn't enough food, so everybody was always like, eat right now, we don't know when we're gonna get it again. But now there's such an abundance that we're actually throwing food away. But still we have that mindset like, come on, you gotta eat your lunch, you gotta eat this. And we actually somehow promoted, and then the snack industry came along and they love advertising their processed Little Debbie snacks. I grew up eating those. We didn't know better. No one told us soda was bad for us. What about when we were telling all our patients to eat Splenda? Because they're diabetic, and now you're like, wait, that's not a good thing. Let's not do that. Your body doesn't recognize it. It's ruining the environment. But medicine is ever evolving, and we have to move along with it. I think that's one of the big things I tell people. My training is very different from what, like you're telling me, you're working in all these different aspects. I don't remember learning all this when I was in training, and I have to continue to educate myself. So the GLP-1s are great, but I do like to remind people, once you're off of that, you're gonna go back. So if you haven't done the work, the mind work and all of that, and looked at your triggers and found ways that you can combat them, you're setting yourself up for failure. It's like meal prep. If you don't already know that, hey, going down that street, Charlie's gonna offer me something and I can't say no, and I shouldn't go down that, you're not gonna be strong enough and you're gonna relapse, or no matter what substance you're doing.
Absolutely. I had someone 2 weeks ago who didn't think they had an issue with overeating, and after starting on a GLP-1, messaged me straight away and said, I can't believe this is what it feels like to be normal and to not want to have food all the time. I thought, well, you didn't think that you needed food all the time, but now, and it's like, yeah, I definitely did, because this is way better. And it's just so much less of a burden. But is there going to be a role for other addictions with these? I know they're very expensive, but what are you seeing? You're the expert in the field. Do you think they'll be used at some point for other addictions?
So there was, and I know we're using it for MASH, we're using it in these aspects, but it's still in the pretty early phases. I haven't seen exactly which one they're working on. I mean, you've probably heard about the psilocybin coming back.
Yes.
Psychedelics, they're becoming where it's in a controlled setting. I've seen a lot of people using that for not just PTSD, but they're also using it in addiction. Ibogaine used to be illegal, and they're using that in certain areas as a way for opioid use as well.
Wow.
Yeah, so there's a lot of stuff that's in the works, and not some. Ibogaine would be one of the natural ones that we're looking at that is coming back.
That's exciting. That's exciting. Well, it's so interesting for you. I was working with a person a couple months ago, and they messaged me recently and said, I'm losing weight. It's going great, but I also haven't had a drink of alcohol in 2 months. She's like, I haven't wanted any. What is happening? It's like, yeah, these are pretty cool. Now I'm trying to think of natural ways to support, because we make this hormone in our gut, and so I'm working on all of that. But what I really want to talk to you about is this habit formation and how you do this in the correctional setting, because I'm sure people come in, like you said, 70% in this kind of acute stage, and then all of a sudden they likely have minimal access, of course, to these drugs, and you have to support them with their new lifestyle design. What is this new lifestyle design kind of process like that you go through with people? I'm sure there's different phases and challenges that you have. Can you tell me about it?
So, obviously, you love habits. I'm thinking you read James Cleary's Atomic Habits.
Of course, multiple times. Love it.
It's a great book, I have to say that. But it talks about the same stuff, right? It's the micro changes we make. The best are the ones that we're going to sustain over a long period of time. Make those tiny changes that don't even interfere with what you do every day. And they just become second nature for us, right? So the habit stacking is one of the things he talks about. And I've seen you just want to kind of put something that you want to implement between two things that you do all the time. So, like, you get up and you brush your teeth and then you walk downstairs to turn the coffee pot on. Those are two things you do every day. Maybe let's throw in, I'm going to do 10 jumping jacks before I turn that coffee pot on. And you do that. So that's kind of like how habit stacking works. We do talk a lot about SMART goals, right? You don't want to say you want to become the president of the United States, because once you're in corrections, that's going to kind of be difficult.
Yeah. Not off the table, though.
So you want it to be specific, but you also want it at the same time to be something that's achievable, something that you can measure, those type of things. So we'll talk about that. And, these things, goals provide you where you want to go. But the road is, how are we going to walk that road? And how are we going to be successful, right? That's where you have to remember that, yeah, it's great to get there, but how am I going to get there is always the big issue. So we have to break everything down again. Same thing, looking at triggers, looking at what's there. I've actually had guys that'll come into corrections and be like, this is the only time I'm sober. I come in here, I feel great. I do that. And I'm like, then why don't you continue it? And it'll just be because of the environmental factors, right? I went back out. And honestly, we've been trained into this immediate gratification culture so much that people have a hard time dealing with normal problems anymore. Where we all have issues. No matter how much money I have or education I have issues, you have issues. But it's what differs is how we handle them, right? And one of the big things, which is interesting, we're just really one step away from being in jail too. Has it ever been where you're so mad and you're just like ready to pound someone and you're upset? And the difference was, okay, I stopped at the last second. And they didn't. I've seen a lot of times, and then I've seen so many patients that'll come in, they had the best jobs, they were earning 6 figures, they had an injury, they got put on opioids, they just couldn't get off of them. And that led to them getting arrested or doing something just to get that. So those aspects make a big difference, and how to work on that. How can we change it? What are your skills that you have? What are you proud of? Some of these guys are the best artists. And I'm like, why don't you draw? Sell those on Pier 39 or try to find a way to do that. You can be an illustrator. Some of them are able to make music. There's so much you want. So we do like rehabilitative therapy too. So we have rehab therapists, and they'll do music therapy. There'll be the coloring therapy that they get. So you're trying to get them to kind of learn. And then the ones who need a degree to get a job somewhere, at least graduate high school. The nice thing is we have so many people trying to go for the sky and the stars and the moon that we're not having many people who want to become plumbers or electricians. And those are things that we are going to need and AI can't replace, right? So tell them we have like training facilities, which will actually train them with these firefighter programs, fairly big in prison, that we had a correctional training facility that's in Soledad, California, where they actually are taught how to be a firefighter. So when we actually had a few years ago had too much rain, and it was called the El Nino, they had to give sandbags to people. And when I went to go pick up sandbags for our home, there were some of the people from prison because they were helping do all that work. And they'll help fight the fires when we have the fires in California. So that's a great way for them to learn a skill or a trade. So the more you increase their self-worth and their value and the way they look at, the better they're going to be. I think that's one of the biggest things, because we tend to be our biggest self-critics, right? So if you start to be like, hey, no, but this is good about me. I can draw a really good cartoon, or I can make somebody laugh. That's the nice part.
Love it. Love it. They're so lucky to have you as a guide. It's been really cool to chat with you, Dr. Vaid. I learned a lot, and I'm also inspired by the work that you're doing. I only have a few questions left, just some rapid fire ones that I'm wondering if you could answer for me because I'm super interested in them. The first one is top 3 lab tests you wish every clinician ordered in early recovery.
So again, it would be the liver function test, kidney function test to help us determine what meds I can give you. Can I give you certain things? B12 levels for the people for ruling out any, are you acutely delirious? Do you have dementia? What's going on? That would be another big one for me. A CBC, because I want to know, are you anemic? I want to know, is your white count high? Are you having some sort of infection that I'm missing, right? Those would be my top labs.
Definitely. Okay, thank you. Second one supplement you'd recommend for most patients and one you'd avoid.
What I would recommend, I think I'm a fan of vitamin D. And when I would avoid the stuff that tells you it's a miracle overnight. Because of the mindset of where we think that anything that's natural is good. You have to remember not all natural things are meant to be taken in, not just because it worked for Sally next door, doesn't mean it's going to work for me.
Oh, that's a great point. And the single lifestyle habit that yields the biggest return on investment in addiction medicine.
Biggest one, I love all 6 pillars, but I think my favorite would be sleep. I've always been a great sleeper. And no sleep Meenu is terrible. You don't want to meet her. So
I'm sure she's great.
I think sleep makes everything better.
I'm sure she'd still be calm and kind, but I hear you.
I think my kids and my husband would disagree with you.
Okay, fair. Show them. All right, that's fair. I get it. Well, Dr. Vaid, thank you so much. It was really, really cool to chat with you. Where can people find out more about you and maybe, consider your private practice? Where can we find you online?
So my website is meenuvaidmd.com. If you go there, that has all the information. One of the best things is I have quite a few educational articles on there as well. So if people wanted to use that would be great. It has my personal clinic number, the address, everything.
Excellent. Thanks so much. I really appreciate your time and I absolutely love chatting with you. So thank you so much for coming on Personalized.
Thank you so much for being so easy to talk to, David. I have to admit, no matter how much I talk, I always get a little anxious, but you made it very comfortable. So
thanks for that. That's really kind. Well, it was great chatting with you and we'll talk again soon.
Thank you. Bye.
Bye.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Deiser and at Get Vitamin Lab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.